Hey there, Dr. Erickson with Essential Motion Spine and Sport, as well as Executive Health Solutions. I want to talk to you about the four most common things that we can do if you have an acute injury to your lower back. Some kind of an exacerbation, something that happens, you pick something up and you get a sharp pain after sitting, after standing. Just, you're not sure what to do. You know you have pain in the back, it feels stiff. Here are the things that I would start with right off the bat that were most likely going to give you some pretty good relief. Number one will be posture, okay? So we're going to start with getting a little bit of a lumbar roll. I just made one with a little bit of a rolled up towel. You want to put yourself first, sit all the way to the back of the chair, and you really need a kind of a firm chair, a stiffer back. What you don't want to use is like a recliner or one where you sit kind of slouched and relaxed in the chair. More than likely that will feel better temporarily, but it will not feel better when then you try to then like rise back out of the chair. It's going to be real hard to get back out. So sit in a pretty firm chair all the way to the back. Get your lumbar roll that I made with a little bit of a towel here and place that real low in the back, right down there. Now you can see as I sit back, it helps keep this kind of curve and my pelvis rock forward and puts me in a nice alignment this way as I sit, okay? So number one is get yourself in the correct posture, all right? Number two would be this. While you're sitting, you can sit more to the front of the chairs to kind of get a little bit of an exercise going for it. Go ahead and feel the difference between what a slouched sitting feels like, so when your spine is really flexed. So you can see I'm flexed here. We don't want to be here for too long. I think we can all agree that this is not a good posture to sit in. Then rock your pelvis forward and sit real tall. Actually overcorrect and go a little bit too far, farther than normal. That's probably going to hurt as well. You'll probably feel pain at both of the end ranges. So a little bit of pain here. Maybe it might even feel better temporarily. It might give you some relief. But then when you come back up here, again, you might get either relief or pain, but just work through it. Back and up. And kind of back and up. What that does is it gets a little bit of nutrition through the bones and joints as you move forward and backwards. Now, once you use this one, this is number two, once you use this one, that's how you find that spine neutral, right? So you come all the way down, then you come all the way up, and then you relax off that about 15%. Right there, there's your spine neutral. So now you just scoot yourself back with that same position, and then you're right back to where you need to be. Not too flat, not too far, just kind of right in that spine neutral. So those two kind of work together, 1 and 2. The slouch over correct, and then using the lumbar roll for the posture. Okay, number 3, very important. Most people that have an acute injury to the low back or pain in the low back have some kind of directional preference. They have movements, they have positions, they have postures, they have activities that make it feel better or worse. So think to yourself, what, over the last couple of days I've had this, what has been making me feel better? What has been making me feel worse? It's important to determine that. So if you feel better when you're kind of standing and walking and moving and being upright, that's going to kind of lead us down one path of a certain direction. Or if you feel better, if it feels worse standing and walking, and you feel better to be, seated, then that's going to give us a different indication. So for those people who feel, let's just start one at a time. For those people who feel worse with sitting, so they're sitting, or worse with bending, or worse with rising from sitting. It's very hard to get up and straight after sitting, but you feel better after you kind of walk around a little bit and stay moving. You tend to have a directional preference into what's called extension, moving backwards, okay? So then what you work on for the next few days would be just working backwards into extension, okay? You can do that in either standing like that, you put your hands kind of this way, and you go backwards. If it's too painful to do that, then I would do it lying. You just lie on the ground, and you use your hands to push up, 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 up this way. You don't have the hips up here, they gotta stay down and relaxed, okay? That's the most common, and so this is gonna affect and be effective for the majority of people, probably 7, 8 out of 10, okay? The other type of directional preference would be ones who feel better in sitting, better being flexed, and they're worse with standing and walking. It's very hard for them to stand and walk, be tall, okay? Then you can either go into, you might have a directional preference into flexion or going forward. So bending, 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 stretch, stretch, stretch. You might have to go forward. You can either do that in standing or in lying. So standing would be just bending at the waist and really flexing. Or you could do it lying down on your back, where you would bring your knees to your chest. And you would just flex, pressure on, pressure off, okay? Just flex a bunch of times this way. So I've given you 2 examples of each direction. One where you have your gravity and body weight loaded, and then one lying down for each, where you then should be a little bit easier. You'll know if these are right when you stand back up. If you do the knees to chest one, or the bending and standing, and as you keep doing them, you're feeling better and better, you're gaining more motion, then it's right, keep going. If you're doing the push-up one, and you're doing this one here, okay, and again, after you do this, and you stand back up, and you're like, it may be hard to do, but I actually feel better when I'm done, then that's probably right, keep going. The reason you would stop is if you pick one of those and it starts to feel worse, then stop. I mean, we gotta talk about that. So that would bring me to number 4. Then the 4th thing would be to stay active. Do not just go home and lay in bed for 2 or 3 days and don't move and don't do anything because the back hurts. Stay as active as you can. If you can walk. If you need to, because walking is worse, maybe you need to bike or swim, but stay as active as you can. Don't just go on bed rest and don't move. Now, so those are the 4 things. I'll kind of review them a little bit again. We had the posture, sitting all the way to the back, lumbar roll. Okay, number 2, using a slouch overcorrect to keep some movement through there. Those 2 kind of go together. I mean, those are really intertwined. Because once you do that, then you go right back into your posture one. Number 3 is trying to find and determine your directional preference, whether it's bending forward or bending backwards. And remember, that's based off of the movements and positions and postures that make you worse. So if you tend to be worse with sitting and bending and being forward, then go this way. Backwards, the opposite. Okay, just think of it opposite. If you tend to be worse with being upright and standing, and you feel better with, then bend the other way. All right, so then number 4 would be the staying active. Now, if something were to happen with any of these movements and you started to get some kind of pain that was starting to move further to one side or down a leg, or you're really getting stuck and you can't move a certain way, or you get kind of shifted, kind of funky, then you need to consult with a professional, a physical therapist, a chiropractor. Find someone that you trust that can give you the answers you need to help you fix those problems. But this will help the majority of people with a very just minor, very central, here, maybe just off to the right or just off to the left, but not going anywhere else. You just did something you were, commonly what we see here is people are doing something either at their house, at the gym, they're deadlifting, they're squatting. They could be as simple as they just were picking up something off the ground. We've had that happen where people just bend over and all of a sudden get stuck. So those kind of things, this will help the majority of people, but just want to let you know on the very quick intro and some advice on the 4 most common things that you can do to fix your low back pain. Thanks.